Israel has been a world leader in containing the coronavirus, but another regional standout has been the United Arab Emirates. Now, there have been over 585,000 infections in the Emirates and over 1,700 coronavirus-related deaths since the pandemic began. The UAE has administered now over 13,300,000 doses of COVID vaccine. That's enough to have vaccinated about 68.3% of the country's total population. Now, leading the way among the Emirates has been Abu Dhabi, which just topped an independent survey conducted by the London-based Deep Knowledge Group, which assessed the COVID-19 response of cities around the world, including in vaccination and testing rates. And this is the result of an efficient, rapid response to protect the health and safety of its residents. Here's more on that in this report.
There was uncertainty everywhere. No one knew exactly how this virus was spreading.
It was the same feeling that everyone around the world shared, because we were sailing into an era that we never explored before.
Successfully controlling the pandemic was essential. Consequences of failure, in both human and economic terms, would be catastrophic. One of the clearest priorities was taking care of blue-collar workers who live and work in close proximity. Testing then became the first priority. This was no small task. The Musafa Screening Center, one of several across Abu Dhabi to meet this challenge, was huge, nearly the size of a football pitch. But building sample collection sites was only half the job. Abu Dhabi needed to massively boost laboratory capacity. In addition to testing, Abu Dhabi also focused on treatment and quarantine.
The efforts that were done and being put in place to fight the spread of this virus from the UAE government was tremendous. It made me also proud because the UAE government showed me that no matter where the person came from, no matter what they did for a job, what their background was, everyone had an equal chance of getting screened and being protected in this country.
And joining us for more is Dr. Ayaz Verji, the medical director of the health center at NYU Abu Dhabi. Dr. Verji, thanks for joining us. I gave some numbers, general numbers for the UAE. Give us maybe briefly some specifics on how the coronavirus tracked through Abu Dhabi, and what is the current situation there?
Yeah, thanks for having me. So as you reported, Abu Dhabi has taken this very seriously since day one, and they've really been on point on the messaging. The different government agencies, whether it be the Department of Health or the National Disaster Management or Federal Aviation Authority, they all have had the same message that we need to take this seriously. And they've also taken vaccination rates very seriously. So you presented some of that information, and I'm very proud of what the country's done. And I think we're very strategically placed to continue to improve the circumstance that we see from the whole UAE standpoint from where we were during our peak, which was probably the January-February timeframe.
Right. Now, one of the sort of unique characteristics or maybe challenges there in the UAE and Abu Dhabi is that the fact that so much of the population are foreign workers or transit, they're not full citizens. How did the government go about there handling that and seeing that the treatment, especially vaccination, would be sort of quickly and equally distributed, even when there are people who are not full citizens?
Yeah, that's a great point. And I'd say the first thing they did is studied the population to see, because as you mentioned, when you have a kind of a migrant worker population, which is so large, and then COVID-19 is a disease that spreads so quickly in group settings. So that's one of the reasons in that population, you would see almost a 60% seropositivity rate compared to a 10% among the general population. So once they identified that, they said, hey, listen, we have to do something about it. And so they've set up vaccination centers, they set up testing centers, field hospitals, and all of that for everybody. It doesn't matter your citizenship. It doesn't matter your residency status. It's for you. And just as an example, a week ago, I took my daughter in for her first Pfizer shot. She's 13. And I was in line with an Emirati, with somebody from India, Filipino. I'm the American there. And everybody's, getting access to free vaccines and free care. And just one other thing I might mention that I was very happy that was announced early in the government with the pandemic was that they were going to cover the expenses also. So even if you didn't have insurance, the government said, we're going to take care of you. So that was something I thought I was very proud to hear.
So let's look a little present and then forward. What are the restrictions still in place in Abu Dhabi? I know there are still some, for example, travel issues. And what could we expect in the next couple of weeks or even months going forward?
So I think we're going to see a slow easing of restrictions. Now, I'm not working in the government sector myself. I'm at New York University, Abu Dhabi, but we do collaborate on various projects. I think that we have seen restrictions easing over the last several weeks. You can now dine with your entire family. Masks, you don't have to necessarily wear outside. Indoors, we're still utilizing them. There's still a checkpoint between Dubai and Abu Dhabi to ensure that testing compliance is appropriate. But I think that as our vaccination rates continue to go up and our infectivity, our case rates and hospitalization rates continue to go down, then we will hopefully slowly be getting back to a new normal. And I think easing it too quickly can also be problematic. And I think the government is taking a conservative approach to that.
Right. Now, Dr. Verji, as a native New Yorker and a graduate of New York University, I know the NYU Abu Dhabi is a reference to the teaching hospital, the great one that NYU has in New York. So that's an international partnership. I'm very curious about that whole subject of international partnerships, especially here from Israel, because of the Abraham Accords. We've now entered in the possibility of these partnerships with the Emirates, and health concerns and coronavirus has been one of the issues.
Yeah, so this is the way forward. And as a New Yorker, you said yourself, it's all of us together. We're all needed. And look what the world could do when we focus together on it. When we brought a vaccine together, this is nothing short of a modern day miracle. This was governments coming together, people from all nations, private industry, pharmaceutical companies, and hospitals, and we created this thing. It's incredible. And I think that, like just at our own university at NYU Abu Dhabi, our vice chancellor put together a work stream for public health of our entire community, which includes doctors and nurses and professors, and we have a mathematician, we have administrators, we've got public safety officials. So it is something we need to look at as we're in it together. I mean, we do live in a global village overall, and that gives me hope when people approach it that way.
I wonder if there's a little quick personal anecdote you can give us of dealing with the coronavirus there in Abu Dhabi.
You mean besides the fact that my son got it and he doesn't listen to me about washing hands? Well, I would say, in all seriousness, COVID-19 pre-vaccine and COVID-19 post-vaccine are two different entities. So I know the vaccine has, all of the different vaccines that have been available have been successful in really mitigating the seriousness of the complications that you can see. So as you're aware, COVID-19 is unique, and it really binds to those ACE2 receptors that are existent throughout your body system, in your nose, in your pharynx, but in your heart, in your GI tract, in your lungs, and it can cause some serious things. Now, with the vaccine, we're basically seeing it turn it into a bad cold, which we're very happy to see. So what we've been seeing in our own population is students who initially were getting sick pre-vaccine time. They would have symptoms that would linger a lot longer. Some of them would lose sense of smell for months. But now we're seeing the people who do get it, and they're fully vaccinated. They get a bad cold. It lasts for a couple of days, and they're just right back onto being normal. So that, I think, is something good.
Well, we'll have to leave it at that. I hope your son had an easy coronavirus experience, and we wish him his best, and we wish you our best. Dr. Ayaz Verji from the Health Center at NYU Abu Dhabi. Thank you for joining us on I-24 News.